Well, hello. It's great to have the opportunity to update everybody again on where we stand with our COVID response and a few other things. So, as I've done before, let me start with thanking all of you. I realize it's been a crazy few months, a lot of hard work, a lot of unknowns that I think now we're learning more and more about our COVID response. But thank you for the incredible work that all of you have done, not only to keep the boat afloat in terms of the last several months, but to continue to improve as a facility. So let me tell you a little bit about where we stand with our COVID response. So I think a couple videos ago we talked about being at a peak. We had 21 patients at one time in terms of inpatient care here at our facility, quite a few outpatients that we were following, and a number of staff that were positive that were self-quarantining at home. We are now down to 2 inpatients. One of those we're hoping will be discharged here very soon. We have 1 positive COVID employee that's at home. We've been at 0 in terms of our positive employees for quite a few days, so we do have 1 now. Clearly those numbers have moved in a very good direction, and we're happy to see that. We're seeing that across our community, looking at all of our hospitals in Charleston and up and down the coast, major reductions in terms of the number of COVID patients. We eagerly await the next steps in terms of a potential vaccine later, and are looking forward to, well, I won't say bringing this to an end, certainly continuing to see a downward trend. So let me talk about what we're doing now. So clearly, as we've seen the numbers come down with COVID, we are looking to continue to increase our care throughout our facility. Have talked a lot about the trade-off between COVID and making sure our patients and our staff are safe, and making sure we're providing care and meeting our mission of providing excellent care and services for our veterans. So we are now talking about reopening and moving in that direction. Let me tell you where we are with that. So as of this past week, we are back to just about all of our operating room cases are now being rescheduled, and we're getting those back in. That's resulting in a few admissions, which is fine because we have plenty of beds. So really back to pretty close to full operation with our surgeries in the operating room. Other procedural areas, GI and some of those other areas, we are also moving back close to 100% on those, and we'll continue to ramp up a little bit more on that. We're doing that in a way that's safe for our patients and for all of you, our staff, with PPE, and really looking at how to do that in a way that we can socially distance with our patients. So that's going well. We talked about primary care and mental health. They really have not fallen off at all, which is an incredible, I think, testimony to why the VA is so special. We did reduce the number of face-to-face visits in primary care and mental health, but really went to a more virtual type of paradigm in terms of our patient care, either telephone calls with our patients or computer connection and some of the video conferencing with our patients. So we are pretty close to 100%, have been for a while with primary care and mental health through either face-to-face or virtual care. Specialty care, we are moving up. Those face-to-face appointments were at about 80% in terms of our specialty care. Just here recently, we ramped that up another notch, and going to continue to move that up, keeping a close eye on all the things that we're doing to make sure that our patients and our staff are safe with social distancing, etc. Dental is now back open here as of a couple weeks ago. We're at about 60% of our normal workload there. Have some new equipment that we've bought in dental to even make those encounters with patients safer for staff. It's not just regular PPE. They have some specific equipment for dental to make sure that we're providing safe care there. So we are moving in a direction of getting back to what that new normal is. One thing I would ask all of you, as you're walking through the hospital, really the 2 things that are most important, as we all know, the most important thing is that we're all wearing masks. Our patients, our visitors are wearing masks. We have moved up our visitation a little bit and allowed a few more family members into the hospital. Let's all make sure we're wearing our masks, wearing them appropriately. You guys know, covering both your mouth and your nose. Let's make sure that we all do that, and we are keeping an eye out across our hospital. Socially distancing is something that is also very important. If you walk by a waiting room and that waiting room is packed and patients are really, really close, please let us know that. We're doing some things to spread those waiting rooms out, to not have the normal staff waiting in a specific waiting room, but to spread them out to remote waiting rooms, etc. So help us do those two things. Masking and socially distancing are how we're going to continue to be able to move ahead. Another thing I'll mention, some of you may know, some of you may not. So our canteen, they actually operate based upon providing excellent service, excellent products to us, but they have to make a profit in our VA in order to sustain their operations. Clearly with the COVID response, our canteen has really taken a hit in terms of staff coming and getting food from the canteen, purchasing things in the retail store. Let's do all we can to help our canteen. We all have that opportunity to get a cup of coffee occasionally, or go down and get lunch, or buy something from the canteen. Please continue to do that, and let's try to do that even more. We want to help them to make sure that they can keep their staff on board and continue to provide us that level of service that they've provided over the years. The last thing I'll mention is what I started with. We continue to improve. You will be hearing from me about some of those areas over the next few weeks where we have continued to set the bar across our VA for access to care, getting our patients in, for quality of care, providing excellent support to our patients, for efficiency, really being able to do a lot with space sometimes that I know is very, very tight. A number of other areas. National awards have been received by our staff over the last several months. We'll highlight some of those. But in a very, very tough time for all of us, we have continued to get better. That speaks to the incredible staff that we have, the incredible teamwork that we have. So thank you so much for that. Thank you for all you do. As we said, things are headed in a very positive direction. We'll keep you posted as that moves ahead. Thank you and have a great day.